All right. So the purpose of this short video is to show you how this AI AI backed software called Nabla Copilot could help help us in our practice as podiatrists. The background here is that I've been using this for a couple of weeks, and it's blowing my mind. So I just want to share it. And my colleagues at a local GP practice have been using it, have been trialing it as well. And I equally there's brain splatter to be mopped up off the wall. So I've got Gareth Milne, who's pretending to be a patient today. He's a podiatrist as well. Many will know him. Gareth, I think we'll crack on with a consultation. But first and foremost, I just need to get your consent that you're happy for us for the computer to take to record our notes. So record my notes and record our conversation. So is that all right for you?
Fantastic.
Cool. Okay, so what in the podiatrist capacity, all I need to do here is click new consultation, and I'll start the conversation. So, g'day, Gareth. How are you? What brings you in here today?
Fine.
Yeah. What brings you in here? How can I help?
Oh, hi. I've got a problem with my foot.
Mm. And what's that issue? What's going on?
It's quite painful.
Mm. Whereabouts?
It's my foot.
Yeah. What part of the foot? Can you point to
The I've got pants on. This bit just down the bottom there.
Oh, okay. Under the arch.
Yeah,
So you've got,
correct. Yeah,
you're getting pain under the. Is it the right foot?
it is the right foot. Yes,
Yeah. And how long's that been happening for?
years,
Years.
long time.
Okay. And so what sort of things make it sore? Is it going for runs, or do you what's happening? How does it happen?
It's painful all the time.
All the time. Right. So when you first
Yes,
when you first get out of bed in the morning, it's quite sore.
very sore. Very, very sore.
Mm, mm. And okay, well, let's just go through a little bit of other stuff first. So, you're generally quite well,
Fit as a fiddle.
but you're not taking any long-term medications for anything.
Nope,
No,
nope. Don't,
it's great. And you don't have any allergies of any sort.
not that I know of.
Yeah. Okay. Well, that's good to know. So, what we'll do, Gareth, is I'm just going to get you up onto the chair, and we'll have a closer look at this issue. Um, so Gareth, I'm going to put you up on the chair now, and we'll pretend that you're going up onto a chair, and I'll be examining your foot. And for the purposes of this exam, I'm going to palpate the um, underneath of your arch. And is it quite sore there if I push there?
Ow, ow,
Yeah,
ow. That's really
yeah.
painful.
So upon palpation, Gareth's quite sore on the medial band of the plantar fascia on the right foot. Um, just proximal, just distal to the insertion point on the medial calcaneal tubercle. So, Gareth, let's have a look at the rest of your foot. You've got a slightly dorsiflexed first ray, relatively flat foot, nice and mobile around the rear foot, and the ankle joints moving quite well. Although I must say, you've got a little bit of stiffness in the ankle there. That's what I call a functional equinus. So you're unable to move your ankle upwards as well as we would like on the right side. If we compare to the left side's moving quite well. Not sore on the left arch, Gareth?
No, that's not uncomfortable.
Not uncomfortable. Good. Okay. And just looking at the right arch now and feeling it, it actually feels a little bit thickened on that plantar fascia. It's a little bit swollen too, I notice. So, well, what we might do is just have a a look at you walking. Uh, and so we'll hop you off the chair and we'll just get you to have a walk down the hallway here. So you're going to, for the purpose of this, you're going to have a walk down the hallway. And I notice that you have a tendency to sort of lift your heel a little bit early, and you're obviously trying to avoid that heel at the moment. So it's clearly quite sore. Gareth, come back into the room. We'll sit you back down, and we'll just explain what I think's going on. And in this case, I think, Gareth, you've got what is commonly referred to as plantar fasciitis, or fasciosis. And I think what we'll do for you today, Gareth, is put a Lodi strap on your foot. It's a strap that'll just make your foot feel a bit firmer, and see if we can settle things down a little. Um, During the consultation, I also picked up that your big toe joint doesn't bend as well as we would like. And so I'm just going to put a pad on the outside of your forefoot, and that's going to help that big toe joint move a little better. And what it'll do is we'll get you back in a few days' time and see if that's made a difference, and then make a bit of a plan from there. If this doesn't help, I might look at getting an ultrasound and just understanding a little bit more about what's going on underneath. And of course, if you could bring your footwear in today. It's a bit of a shame that you've only brought jandals, but we'll have a look at your footwear and do a review of that next time as well. How does that sound?
I'm really excited about this. My foot has been particularly painful, and I'm just looking for anything that's going to help.
Fantastic. Okay, Gareth, let's crack on. So I've just clicked on finish consultation, and that's generating a note now. And in this note here, we'll just take a few seconds, and what we'll end up doing is reviewing it ourselves later. So Gareth's come in with a painful right foot, pain in the right foot, bottom part, painful all the time, very sore in the morning, no specific triggers, generally healthy, no long-term medication, allergies. Physical exam is summarized here. And a summary of the assessment and plan has been completed as well. Obviously, you can see some minor spelling errors and probably some terminology that you'd change, like Lodi, so it looks something like out of Star Wars. But by and large, this we would then copy. Well, in practice, we would copy this note and transfer it into our practice management system. And it's as simple as that. So yeah. So put your podiatry hat on now, Gareth. What do you think?
I'm very fascinated on how it picks everything up so easily. What I'm interested in is it obviously you have a is this a standard? This is a medical template, I assume. Is that what it's already predetermined with those categories?
Yeah, so
is that what you understand?
Because we've been using this for a little while, we've set this up in a podiatry template or allied health podiatry template. So when you set up your own program, you'll elect based on your profession. So if you're a psychiatrist, you would set up in psychiatry mode and general practice, etc., etc. But this one is a podiatry format, or allied health and subcategory podiatry. And from what I understand, this is using a Chat GP 4, so it's learning as it goes. And the database that this is based on is using around 20,000 clinical consultations. So this is how it's been able to get to this stage, but it'll only get better as you go. And after each consult, you can submit the edits that you made if you want to. But this is easily saving me 5 to 10 minutes per consultation.
how do you? The concept is fascinating. Sounds great. How does it? How do you navigate a consultation that moves around the room, um, rather than just sitting in the seat? The microphone will pick up what's in the room at all parts, I'm assuming.
Yeah, that's a good question. From what I've seen in my practice is that we'll take people out into our gait assessment area, and I will have to make a note in my own head and then regurgitate that when we re-enter the room. And at that point, the software will record that information.
Okay, so over time, yeah. So over time, so in the room is fine if you're moving outside of the room. Have you taken your device with you? And
No, no. Well, I've got I mean, in this case, we don't have any sophisticated speaker system or microphone, but at clinic we've got a plug-in little microphone single unit which can be moved a little bit, and it can even go onto Bluetooth if you want. But I've never had a need for that. I don't really travel a long way in my practice.
in regards to conversation that's not directly related to their condition, but may relate to their overall, how do you say? Sometimes there's general. Yeah, I think you know what I'm saying. There can be general chat that's not directly, but is indirectly related. It
Yeah,
will decipher that and not necessarily and work out what's appropriate for the notes.
yeah, yeah. And I think if we look back on this video later, once we share it, you'll hear that there's a reasonable bit of faff at the start. How's it going, that sort of thing. Um, but yeah, it will decipher what's clinical and what's not, and don't ask me how, but it does.
No.
And yeah,
How often are you presenting? So are you finding that it's a half an hour, say a half an hour initial consultation
yep,
will end up being titrated? Is that a correct word? It'll be shrunk down into a note that looks similar to that, despite there could have been
yeah,
thousands and thousands of words.
absolutely. And that's it's quite unsettling actually, because you realize how much of what you talk about can be funneled into quite a concise format. Um, yeah, so in some ways I find this quite provides a lot of clarity. You know, patient presented in this case with a painful right foot. Well, yeah, actually that's what they presented with. Um, and yeah, I it is quite clever at that.
I wonder, is this also, this is slightly segueing away from the actual task, but I feel as appropriate is that health literacy can be a concern, but also communication is two people providing information, but one's receiving, one's giving, and vice versa.
Yeah,
Does it enable us as practitioners to be quite precise about what we're trying to say, and how we say it, which enables the patient? So we could also be learning about our own consultations, and the way that patients receive, the way that we provide information as health practitioners
yeah,
in a
definitely,
positive way.
Gary. Yeah, I've what I've noticed is that because I've been trying to dictate in a way to the software, it's my language has changed a little bit. I've had to try and word it in the way that the software will pick up, but that may not be necessarily a lingo that a patient would understand. So it's there's a bit of a finesse, or a bit of you know that will adapt. I think I will adapt as well, knowing what the software is picking up, and obviously fundamentally it's most important that the patient understands. interestingly, on that note, you can create it by clicking this button. You can create a patient instruction list for the patient if you want to communicate a note for them afterwards. Again, you'd need to edit it in this case, but we've applied a Lodi strap. I'm not sure how relevant this is. It needs a bit of fine tuning, but you know, it's in some ways that's quite a clever little thing too.
Well, there's possibilities for advancing that, depending on what appointment type you have.
Yeah, absolutely.
In front of you.
So I think you can potentially edit that and feed that back to the software so that it learns a little bit more. But this could be emailed to a patient, or you can create a referral note based on that, and send that off to whoever you want to.
Right.
Yeah. Listen, what I'll do, G-Dog, is I'll just stop the video now, and so we can share it. It's not too long for people and bore them, but that's the main message I just want to get out to people, is to give it a go. It's free to try. You get 30 consults a month free, and yeah, I think it can make a real difference to you and your practice and your patients. I'll stop that. Yeah, it's pretty amazing, eh?